Good afternoon, Quad City Times viewers and readers. My name is Tom Lowy. I'm a reporter from the newspaper. And joining me right now is Janet Hill. You're the COO of the Rock Island County Health Department. And right now we're standing outside Mount Zion Missionary Baptist Church in East Moline for a free clinic. Janet, let's talk a little bit about the importance of this specific clinic.
So from a health equity standpoint, we need to make some special efforts to reach special populations. There's some vaccine hesitancy in communities of color, so we are making a special outreach effort here along with Pastor Harris and his congregation to make sure that we make sure that the community in his congregation and the community at large understands that the vaccine is safe and has effective for every person.
Okay, and I noticed when I came in, the first couple of people here were definitely walk-ups, people who read about it in the newspaper, saw it on TV, and just decided to come today. How do you expect that effort to go? Do you think you'll get a fair number of walk-ins off the street?
I do. This is how the vaccine effort is starting to go. The people who wanted the vaccine and knew they wanted it back in December have already been vaccinated. So now we're reaching out to people who would get vaccinated if it was convenient for them. So we thought coming to a neighborhood, to a place that they're already familiar, would be a really great way to get them to take the opportunity. And then plus we have not had a clinic in East Moline. So this is another great opportunity to bring vaccine and vaccine education to the community.
Is this going to be the vaccination model to a certain degree going forward, rather than a stationary clinic, like actually going into niche communities and targeting specific populations?
I wouldn't say that it's until the beginning of June we have the Camden Center.
Right.
So that is going to be our main focus. We are capable of doing thousands of vaccines a week and have the assistance of the National Guard. Today we have the health department employees and leadership along with staff from community healthcare, so we're very happy to have them too.
Right.
This is a lot of manpower and a lot of effort to come to a smaller vaccine clinic. We're happy to do it because we want to reach we want everyone to take the vaccine, and if we need to come to neighborhoods, that's what we'll do.
Right.
So going forward, I could see more of this, but this really is a resource issue. This is public health is chronically underfunded, and community healthcare is also a nonprofit organization.
Right.
So funding is of the utmost importance.
So still more efficient to be kind of a stationary hub clinic model.
I think that we can probably end up doing both, and as the summer goes on, there'll probably be more of these pop-up clinics.
Right.
The health department and community health care are not the only places to get vaccine. Many of the pharmacies, and you're starting to be able to get it in your own doctor's offices.
Right.
So, we just wanted to make it as convenient as possible. It is so important that every person 16 and older get vaccinated, and if we need to make sure that people have ample opportunities to get that done.
Janet Hill, thank you as always for joining us.
You're welcome.